Let's discuss the knee joint today. Knee joint is a complex joint. A complex joint is the one which has more than two articulating surfaces. So in case of knee joint, we have the lower end of femur, the upper end of tibia, and the patella anteriorly. So knee joint has two articulations. One is between the femur and the tibia. This is condylar type of joint. And the other is between patella and femur. This is saddle type of joint. Here you can see in this picture, this joint between the lower end of anterior surface of femur with patella is the saddle type of joint. And this one that is between the condyles of femur and the upper condyles of tibia is the condylar type of joint. The stabilizing factors of knee joint are the muscles and the ligaments that are attached to the knee joint. And the most important muscle is the quadriceps femoris, which supports it anteriorly. The joint capsule of the knee joint is this dotted structure. It has two parts, the outer fibrous layer and an inner synovial membrane. So the joint capsule is deficient posteriorly for the passage of popliteus tendon, and it is deficient anteriorly where patella is attached. And the synovial membrane covers the joint space on all sides. In this picture, this green structure is the joint capsule. This black dotted line is the synovial membrane. These are the menisci, the medial and the lateral menisci. This is the cruciate ligament, the anterior and the posterior cruciate ligaments. In this picture again, we can see the articular cartilage, the synovial membrane, and this infrapatellar pad fat. Here we can see the various bursa which are very important in case of knee joint. These are present anteriorly on the lateral side and on the medial side. The bursa which are present on the anterior side are located around the patella. This is patella. The bursa in front of the patella is called prepatellar bursa. The bursa that is above the patella is suprapatellar bursa, and the two bursa which are below the patella are called the superficial and deep patellar bursa. In this picture, we can see the cruciate ligaments, anterior and posterior, the menisci. Here, this green one is the prepatellar bursa. This is the subcutaneous and the deep infrapatellar bursa, and this is the suprapatellar bursa. What is ligamentum patelli? The quadriceps femoris from the anterior thigh come down together as a ligament and get attached on the tibial tuberosity. This is the ligamentum patelli. It is supporting the knee joint from the front. Fibular collateral ligament is attached superiorly to the lateral condyle of femur, and inferiorly it is attached to the head of the fibula. It supports the knee joint from the lateral side. Tibial collateral ligament is a degenerated tendon of adductor magnus. This is tibial collateral ligament or the medial collateral ligament. Superiorly, it is attached to the medial condyle of femur, and inferiorly, it is attached to the medial surface of the upper end of tibia. It supports the knee joint from the medial side. In this picture, we can see the tibial collateral ligament, the fibular collateral ligament, and the articulating surfaces of the knee joint. Now, what is oblique popliteal ligament? Oblique popliteal ligament is basically an expansion of the tendon of semimembranosus. This is semimembranosus, which is a muscle of back of thigh. It gives an oblique expansion that is called the oblique popliteal ligament. This also supports the knee joint from behind. Then are the cruciate ligaments. The anterior cruciate ligament becomes taut during extension, and the posterior cruciate ligament becomes taut during flexion. Now, attachment of the cruciates is such that the anterior cruciate ligament is attached to the anterior part of superior surface of the intercondylar area of tibia. It goes up, backwards, and laterally and gets attached on the lateral condyle of femur. And the attachment of posterior cruciate ligament is such that it is attached on the posterior surface of the intercondylar area of tibia. It goes up medially and forwards and gets attached on the medial condyle of femur. Now there are two menisci whose function is to deepen the articular surfaces. The menisci are C-shaped structures. They are two in number. One is medial and one is lateral, and they are attached on the upper surfaces of the tibia. They provide cushioning between the two condyles, the femoral condyles and the tibial condyles. They deepen the cavity stabilize it. Plus, they divide the joint cavity into two parts, an upper part where flexion and extension is taking place, and an inferior part where rotation is taking place. Here you can see this is the medial meniscus, this is the lateral meniscus, this is the anterior cruciate ligament, this is the posterior cruciate ligament, and this is the patellar ligament. These are the ligaments of the knee joint. Here again we can see these are the sockets for the menisci. These are the attachments of anterior and posterior horns of the medial and lateral menisci, plus the anterior cruciate ligament and the posterior cruciate ligament. This is basically the superior surface of the two condyles of the tibia. Now, what are the various muscles acting on the knee joint? Knee joint, the flexion of the knee joint is done by the flexors, which are the quadriceps femoris along with tensor fascia lata, and the flexion is by the hamstrings, which are the flexors and located on the back of the thigh. Here again we can see that these are the cruciates. If there is damage to the cruciate ligament, anterior cruciate leads to anterior displacement of the tibia. This is called anterior drawer sign. And if there is damage to the posterior cruciate ligament, it leads to posterior displacement of tibia. That is called the posterior drawer sign. Now, what is the locking and unlocking of the knee joint? When the foot is on the ground, there is slight medial rotation of the femur on the tibia, and this is caused by the vastus medialis. It leads to locking of the knee joint. Now, if we want to flex the leg, for that we need to unlock the knee joint. The unlocking is done by reverse movement. That is, the knee joint moves laterally by popliteus, and hence flexion can take place. So, the locking and unlocking of knee joint is very important. When the knee joint is extended and foot is on the ground, there is medial rotation of femur on tibia by the vastus medialis. And when there is unlocking, for that there is lateral rotation of femur on tibia by the popliteus, and the leg can be flexed. These are the various muscles producing these movements. As I have told you earlier, the extension is by quadriceps femoris and tensor fascia lata, and the flexion is by hamstrings and partly by gracilis, sartorius, gastrocnemius, and popliteus. Here we can see that if there is damage to the anterior cruciate ligament, leads to positive drawer sign, the tibia moves anteriorly. And if there is damage to the posterior cruciate ligament, the tibia moves posteriorly, hence a posterior drawer sign. What is unhappy triad? Unhappy triad is a clinical condition. There is simultaneous disruption of three structures: the anterior cruciate ligament, the medial meniscus, and the medial collateral ligament. When these three are damaged collectively, it is called the unhappy triad. So this is all about the knee joint. Thank you.